Wash hands. Gather supplies together. Introduce yourself and identify the patient.
Nicole Rodriguez?
Yes,
Hi, how are you doing?
I'm not that good.
It's okay. My name is Rosalie. I'm going to be your medical assistant for today. Can take a seat if you want right here.
Verify the patient's signature on the informed consent.
Can you verify your date of birth for me, please?
February 15th,
And the last four numbers of your social?
567.
Okay. Is this your signature right here at the bottom of the informed consent?
Yes.
Okay.
If the patient has any questions,
Do you have any further questions?
instruct the patient to use the restroom to empty bladder and bowel.
If you need to use the restroom to empty your bladder or bowel, now will be the time.
No.
No?
Wash hands. Sterile technique, emptying the lumbar puncture tray. Position the patient in a lateral recumbent position with the back on the edge of the examination table.
All right. Daddy, if you could just go to the other side for me, please.
Okay.
Thank you. Okay, now we're just gonna lay back, okay? Have you all. And now turn yourself facing the father. And get back towards me. Perfect. There we go.
Drape the patient for warmth and privacy.
It's okay. It's all gonna be over soon, alright? Go let the ground for me.
Instruct the patient and the father to help the mother draw the knees to the abdomen and to grasp the knees to hold them in place.
Okay, Mom. Now you're just gonna lift up your knees to your chest as much as possible. You can help her out, please. There we go. Lift up her legs for a second. There we go. Perfect.
Instruct the patient that during the procedure, the father must help the mother breathe slowly and evenly refrain from not talking.
Okay. You're just gonna try to have deep breaths for me and try to restrain yourself from talking as much as possible. Dad, if you see this machine right here, this is the fetal monitor. So if you see those waves right there,
Okay.
when they're at its highest, that means that she's having a contraction and it's hurting her the most. So when it goes down, you're just gonna tell her to take a deep breath, okay?
Okay,
I
perfect.
need you to be watching that for me.
Drape patient with glossy out. Open the surgical prep tray and pour sterile water into the provided areas.
Okay, sweetie, just breathe. Just
You
breathe.
guys are doing great.
Breathe one more time. Okay, sweetie, it's okay.
Don sterile gloves.
Just breathe. Okay, sit.
Prep the puncture site with antiseptic soap solution beginning at a puncture location and prepping in a circular manner. Asking the patient to breathe.
Take deep breaths for me, so it's gonna be a little bit cold, okay? Take a deep breath for me.
Okay, sweetie, just breathe. Just breathe.
One more time. Great. You guys are doing a great job, okay?
Thank you.
Grab syringe.
Okay, you're gonna take one deep breath for me.
Okay, sweetie.
Good. One more. One more. Take a deep breath.
Okay, sweetie, just breathe.
One more deep breath. We're almost done, okay? One more deep breath. One more. Last breath. And good.
Remove sterile gloves and dispose of appropriately. Assist the provider as needed.
Hi, Ms. Rodriguez. My name is Dr. Cass, and I'll be your doctor for this procedure, okay?
Provides provider with butterfly needle.
Take a deep breath in for me.
Assists the patient to maintain the knee chest position.
If you could just help her maintain her knees as close to her chest as possible.
Passes lavender tube. Helps provider with syringe.
It's okay, sweetie, just breathe. Okay, good.
Helps provider with swab. A sterile dressing is applied to the puncture site. At the provider's direction, have the patient straighten legs.
Okay. You could just straighten your legs for me. Just help her out. She doesn't feel anything much right now. Here we go. And you're just gonna turn with your back towards the bed, okay?
Monitor vital signs.
Okay, perfect. Just put this up.
Cap CSF specimens tightly.
Can you get your finger, please? This is just for oxygen, okay?
Okay, sweetie.
Here we go.
Remove gloves and dispose of appropriately. Wash hands. Appropriately label the CSF vials.
Just breathe, sweetie.
Paying attention to detail, complete the laboratory requisitions. Dispose of equipment per OSHA. Accurately record procedure. Thank mother and father.
Well, you guys did great. It was a pleasure to meet you guys. How are you doing? Good.
Thank you.